I think the test from Avellino Labs is a great tool. We've had a couple instances where we've used the testing and now we're considering using it more often. What we've seen is we've had these rare instances where we've had unusual presentation after refractive surgery, where we're seeing objective signs of corneal dystrophy that have appeared. And so when that happens, we want to get down to the bottom of what's the root cause and what's the diagnosis for these patients. And typically, in the past, it would be sort of all kind of conjecture, but now we do have a definitive test that can either rule in or rule out corneal dystrophy, particularly Avellino corneal dystrophy. And we've had a couple patients that have presented. We've done the testing. Those patients did turn out positive. So it was sort of good news, bad news. The good news is now we know what the diagnosis is. Obviously that's a diagnosis that can be hard to swallow for patients. But what's nice is there are emerging technologies in the future that will allow for CRISPR technology that may be able to reverse these changes. So it's nice now. Now I can sit down with a patient that turns out to be tested positive and say, hey, there is good news in the future, that there's likely in these patients' lifetime, not only years away, that we will have a treatment for Avellino dystrophy. And so I think it's nice to number one, give these patients that present a diagnosis, and so we understand what's going on. The patient or the referring doctor can understand what's going on, but also it has implications not only for the patient, but the patient's family members. We've had some patients that have had multiple family members that have had LASIK or considering LASIK, and allows us to then kind of dive deeper. As with autosomal dominant disease, you can then sort of extrapolate and say, okay, should we test? Certainly, anybody that's tested positive, those family members should be tested before considering refractive surgery. So for us, it's been a great diagnostic tool. I think it's also just the tip of the iceberg of what might present in the future. I can imagine an expansive array of testing that can help rule out other pathologies that can present around the time of refractive surgery or other eye conditions. For example, ectasia would be a great test that we can understand and help rule some of these borderline patients in or out of refractive surgery. So all in all, I think we're just the tip of the iceberg of genetic testing, and I think Avellino Labs is leading that.